Welcome to this module on documentation standards in aesthetic practice. In the world of aesthetic nursing, the quality of your charting is as critical as the precision of your needle. Because aesthetic procedures are often elective and focused on appearance, our documentation must move beyond simple notes. It must serve as a comprehensive, objective, and forensic record of care. Accurate documentation is the bedrock of patient safety. It demonstrates that care was delivered not only skillfully, but also safely and appropriately within the professional standard of care. When we document, we aren't just recording a transaction. We are building a clinical history that protects both the patient's health and the practitioner's professional integrity. To understand why we document the way we do, we must look at the clinical judgment loop. Documentation is the physical manifestation of your nursing process. It tracks the journey from the initial assessment, where you identify the patient's baseline, to the plan you develop, through the implementation of the treatment, and into the crucial evaluation phase. Finally, if a result is unexpected, documentation tracks the escalation process. Well-structured records allow any provider, not just the one who performed the treatment, to understand exactly what occurred, when it occurred, and how the patient responded. This is the essence of continuity of care. If a patient returns days later with a concern or a complication, your notes are the only map available to navigate that situation effectively. Aesthetic documentation should be disciplined, focusing specifically on 4 pillars: objective findings, accurate timing, visual records, and treatment traceability. The first pillar is the use of objective findings. In aesthetics, it is easy to slip into subjective language because we are dealing with beauty and looks. However, for a medical record to be valid and defensible, it must focus on observable, measurable clinical details rather than subjective opinions. When documenting, you should systematically describe the skin's appearance and color. Is it arrhythmic, pale, or cyanotic? You must note the presence and degree of swelling, redness, or bruising, using anatomical landmarks to describe their exact location. One of the most critical objective measures in injectable aesthetics is the capillary refill observation. This is a vital sign for skin perfusion. You should document not just that you checked it, but the specific timing, for example, capillary refill less than 2 seconds. When recording patient concerns, use their own words. Patient-reported symptoms should be quoted directly whenever possible. If a patient says their skin feels heavy or tight, record that precisely. Finally, always specify the exact location of treatment areas using medical terminology, such as the supraorbital region or nasolabial fold, rather than vague terms like the cheek. Let's look at an example of how this shift in language changes the clinical value of a note. Instead of writing, "Skin looks concerning," which is a subjective opinion that provides no actionable data, you would document, "Blanching observed along right nasolabial fold with delayed capillary refill." This objective language improves clarity, facilitates better communication between clinical team members, and provides a much stronger defense of your actions should the record ever be reviewed. It tells the reader exactly what you saw, allowing for a more accurate assessment of potential vascular compromise. The second pillar is the use of timestamps. Time documentation is a critical safety component, especially when you are monitoring the progression of symptoms or responding to a complication. In a fast-paced clinic, minutes can matter, and your documentation must reflect that precision. Your record should include specific timestamps for the start and completion of the procedure. If a patient experiences a reaction, you must document the exact time of symptom onset. This helps determine if a reaction was immediate, such as an anaphylactic response, or delayed. When a complication arises, the clock becomes your most important witness. You must log the time of your clinical observations, the exact time the presiding physician or medical director was notified, and the time of any escalation or transfer actions. These timestamps create a clear chronological timeline of events. This is essential when evaluating patient outcomes or reviewing adverse events during a retrospective root cause analysis. It proves that you acted with the necessary urgency required by the situation. The third pillar is clinical photography. In aesthetic nursing, the camera is as much a clinical tool as the syringe. Visual records provide a level of detail that text alone cannot capture. Photographs are used to document the baseline appearance before any treatment begins. This is vital for managing patient expectations and identifying pre-existing asymmetries. We also use photos to document immediate post-treatment results and, most importantly, to track areas of concern or complications. A photo of a suspected hematoma or skin mottling provides a baseline to see if the condition is improving or worsening over time. However, clinical photography comes with strict responsibilities. First and foremost, you must ensure that specific patient consent for photography has been obtained and documented. You must follow your facility's privacy and storage protocols to remain compliant with data protection laws. To make photos clinically useful, strive for consistency. Use the same angles, the same background, and consistent lighting for before and after or progress shots. Finally, remember that these photos are part of a medical record. They should never be stored on a personal mobile device. They must be stored securely within the patient's official medical record, according to your clinic's policy. The fourth pillar is product and lot tracking. Most aesthetic treatments involve the use of injectable products, such as neuromodulators and dermal fillers, or medical devices. Because these are implanted or injected into the body, traceability is an absolute safety requirement. For every treatment, your documentation must include the full product name, the manufacturer, the lot number, and the expiration date. You must also record the total amount used, for example, the number of units or milliliters, and the specific injection site or treatment location. Why is this so detailed? Traceability allows the clinic to identify exactly what was put into a patient's body years after the fact. If a manufacturer issues a product recall, you can immediately identify which patients are affected. If an adverse event occurs, such as a late-onset inflammatory response, having the lot number allows for an investigation into whether the issue is isolated to a specific batch of product. Complete product documentation is not just a best practice. It is a hallmark of clinical transparency and regulatory compliance. As we conclude this module, let's review the safety gate. Before you finalize any patient record and move on to your next case, perform a quick internal audit. Does your note contain objective clinical observations? Are the timestamps for key events accurate? Have you included clinical photographs to support your text? Is the product information, including the lot number, fully recorded? And finally, if there was an issue, is the notification of the provider or supervisor clearly documented? Incomplete records are a significant risk. They make it nearly impossible to reconstruct clinical events later and can undermine the safety decisions you made in the moment.